Hello, my name is Mike Heege and I'm the Chief Finance Officer at the Trust. And as we start this new financial year, I wanted to provide a brief update on the finances for the organisation. So as some of you will know, this organisation has had some challenges in the past with its finances, to the point that we had to borrow money from the Department of Health in order to pay the bills. But I'm really pleased to say that that position has improved, that since COVID, with more investment into the NHS, we've now been able to deliver, for the last 4 years, financial break-even for the organisation. But not only that, we've also been able to invest in line with our strategy. We've built new capacity in the organisation, such as the Cambridge Movement Surgical Hub and the U-Block. We've been able to invest and support our staff with a £2.5 million package of support. We've also been able to increase the number of staff that we have in the organisation. It might not always feel like it, but we have been able to invest in our workforce. However, what we know is that nationally there's less money to go around, and that means that we're going to need to make some savings. And that's like every organisation in the NHS at the moment with that focus. For us, that means 53 million, and that sounds like a really big number, but in the context of our overall budget, which is 1.5 billion, I'm sure we can achieve that. What we need to do is make our money count. We need to look at the areas where there's opportunities to reduce waste. We need to identify the things that get in the way of us doing the job that we want to do. Not only will that help us deliver our financial plan, but I'm confident that it will also improve the quality of the service that we provide to our patients and make all of our working lives better.
So we've just heard Mike talk about the financial challenges we're facing this year. One of the ways we're seeking to address that is through the Improving Together programme. And that really consists of 3 different aspects. So what are the things that get in the way of you doing your job? So what are the barriers and how can we get rid of some of those? Where is the waste in the system? So things like unnecessary blood tests, for example, that we might not need to do. And how can we use technology more effectively, both for you as staff, but also for our patients? That would help us achieve the triple aim of financial sustainability, of maintaining or even improving the quality of care we offer to our patients, and making it a better place to work for our staff. The 2 areas of focus for this year are inpatients, thinking about how we can get patients home as soon as they are well enough to go home. The second area that I'd really ask you to think about is outpatients. So this is an area that's not changed significantly in the last 15 or 20 years in the NHS. And there are, I think, lots of opportunities for us to do things very differently. So where can we see patients virtually rather than bringing them into hospital? Where can we see patients and look at the results for any of the tests that they've had, but not necessarily need to see them, so the patient not being present for that appointment? Or indeed using technology such as MyChart to communicate differently with our patients. So what I'd really like to ask all of you is to start to talk about this in your teams, to really think about if you've got any suggestions for how we can do this differently. Please get in touch. We really want to work with you. We can do this together and we really need your help.